Good afternoon, everybody, and thanks for tuning in. Welcome. Welcome to John Kelly's Thrive. I hope you're all doing well out there and staying safe. Today, we're going to be focusing on what's a good evaluation. What's a good evaluation for your loved one who may be coming in for treatment? It's very important that you know some of the things that I think are important, my opinions on what's very, very valuable when doing a good evaluation. But first of all, I want to say, most importantly, is that addictive illness should not be evaluated in some kind of cookie cutter approach or one size fits all. Everybody is different, okay? We don't all look the same. We don't all dress the same. We all don't drive the same cars. We all don't have the same tastes, etc. We are all different people. We focus on treatment individually. There is no one way to treat sugar diabetes. There's no one way to treat cancer. There's no one way to treat arthritis. There is no one way to treat just about any disease. So that's why it's very important for me to try to have you understand that addictive illness is a disease and it's no different. Everybody's different. So when focusing on treating addictive illness, we have to keep the individual in mind. It has to be an individualized approach to help the person figure out what's the best way to recovery. We're only support. They have to recover. It's their journey. We're only support. We can show them the path, but they have to walk the path. With that being said, that it has to be individualized, for the first evaluation, the initial session, I truly believe it's important for the family to be there. I believe family support is paramount in the recovery of somebody suffering from addictive illness and is badly needed. So I always ask a family to come in. Back when I was doing a lot of evaluations, I always wanted the input from the family because the family can give you information that you might not get from the client. The family can tell you how he's been acting at home and in the family system. The family can tell you what his behavior's been like, how he's been acting socially, if there's been any antisocial behavior. This is all very, very important and important information for a clinician that's doing the intake or the initial evaluation to know. And sometimes clients aren't going to be forthcoming with this information because they don't want to look bad in front of the clinician. But this is how addictive illness works, and this is what you have to sift through, okay? The second thing I like is a good physical. Because if any client comes in or a person is seeking help, you have to have a complete understanding of what's going on underneath, what's going on in the body that we can't see. Do we have any heart problems? Do we have any pancreatitis? Do we have any liver problems? Is there any disease that hasn't been identified yet? So it's very good to have a really good physical on the person before you move forward or in the course of moving forward in treatment. Because that way you can identify anything that might try to interfere with the person's recovery. And if something is found, it needs to be treated immediately to help this person and to support this person in recovering from addictive illness. The second thing I want to talk about is the different drugs of choice that people get into that can wreak a lot of havoc internally in the body. And of course, first of all, we're talking about the biggest killer out there these days, which are the central nervous system depressants, and that is heroin. That's different opioids of choice, oxycodone, roxicodone, Vicodin. Any strong central nervous system depressants can really upset the person's health and really lead them down a path to self-destructive behavior and eventually death. Okay, we have a lot of overdoses out there, more than ever. Okay, the other thing are the central nervous system stimulants. We're talking about, cocaine. We're talking about crack cocaine. We're talking about methamphetamine, and there's a lot of meth out there. Meth is making a major resurgence. We see it all around the country. Very, very dangerous drug, insidious drug, if you will. Okay, and then we have legal medications that are out there that can be abused in the central nervous system stimulant family, and that would be your Adderall, your Ritalin. So all these have to be taken into consideration. And when a person's being evaluated, they have to look for any damage that could have taken place from these type of drugs. Stimulants can really cause seizures, strokes, heart attacks. They can cause extreme paranoia, and they can cause extreme psychotic breaks and violence. Okay, so they have to be taken into consideration. Also, hallucinogens. Okay, they have to be looked at. If somebody's using any kind of acid, LSD, or any other kind of hallucinogen, it needs to be looked at. And there are a lot of them out there these days, because that can have major dangerous repercussions on a person's brain, their neurotransmitters and brain chemicals, okay? And they can create a lot of psychosis within a person. And sometimes people, can go on a trip and not come back, as you've heard. Also, to really have a good grip on all of this, I think it's really important to have an extremely good psych evaluation, because as a person is losing this brain chemical or neurotransmitter, they may go into deep depression, they may become more anxious. There's a lot of underlying issues, mental health issues, along with depression and anxiety disorders. You can also have a lot of post-traumatic stress. So you really have to have a grip on this, and there may be a need for medication and for further psych testing to get a better handle on exactly what's going on in a person's mind. With all that being said, I want to thank you very much for your time. As always, thank you so much for your comments. Please continue to comment. Thank you so much for your info. We read all of it. Please subscribe. Thank you so much for the subscriptions. To those of you that have already subscribed, we can't thank you enough. It's a new channel. We're trying to get it off the ground. A lot of people out there need a lot of help. Most importantly, please take care of yourself. We're in rough times right now. Stay safe, be well, and thank you so much.